Let's go through the images for the axial skeleton. There are 5 pages to the worksheet for this part of the skeleton. Before moving on, make sure you've already gone through each of the pages yourself and identified the bones and features. Then proceed with the video. So the first page, we want to identify bones of the skull. So we have the frontal bone. You can also see it here. The maxilla is this upper, sort of your upper lip bone here. The mandible is the lower, your jaw. The zygomatic bone is going to be the apple of your cheek. You can see a little zoomed in view here of the zygomatic bone. This is its shape here. The nasal bone, obviously this zoomed in view, is the top of the nose. The lacrimal is going to be on the inside portion, the medial portion of the orbit. We can see cervical vertebrae, see the vertebrae of the neck. The vomer is the bone here, in the nose. We can see the inferior nasal concha coming here up to the side. This is actually wrong. This would be the temporal process of the right zygomatic bone. There are 2 zygomatic bones, so we're going to pick the right one. So if we do the temporal process, it means the portion of that zygomatic bone that's pointing back towards the temporal bone. So this would be the location of the temporal process of the right zygomatic bone. Then we have the zygomatic process of the right temporal bone. We can see that quite nicely here. Obviously, here's our temporal bone. This is our right temporal bone, and then the zygomatic process I have shaded in because it's the portion that's pointing in that direction and connecting with the zygomatic bone. The mastoid process of the right temporal bone is this portion here. We can feel it right behind your ear at the base of the skull. Squamous suture is this border here of the temporal bone. The coronal suture we can see between the frontal bone and the parietal bones. And the external auditory canal of the right temporal bone is right here. For the ribs, the first 7 are true ribs. The next 3 are false ribs. And the last 2 are floating ribs. You can see the floating ribs here. The false ribs, we can see as they come around, they're all attached via hyaline cartilage up to the sternum. The true ribs are the ones that are directly attached to the sternum. And then we have at the very bottom of the sternum, the xiphoid process. The manubrium of the sternum is here. I'll put an X here for the xiphoid process. The thoracic vertebrae we can see as any vertebrae that these ribs are attached to. So we have some thoracic vertebrae right here. The lumbar are below that. They do not have ribs attached to them. And the sacrum forms the posterior part of the pelvic girdle. We can see the spinous process of the lumbar vertebrae. We cannot see that in this picture. We do see the transverse processes of the lumbar vertebrae, but we don't see the spinous process. And we do indeed see the body of the lumbar vertebrae. The features defined of our mandible down below, using this image at the bottom. We have a right mental foramen, that's a hole where vessels and nerves come out. We have the right ramus, this is this upright portion. The right coronoid process is here. The mandibular condyle is this posterior portion, actually makes part of your TMJ joint. Notice we have the left mandibular foramen because we can see that over on the left side. And then the body of the mandible is just this main bulk portion. These are cervical vertebrae. We want to first find the transverse process. Obviously, this is the outer portion. The vertebral foramen is the hole that the spinal cord will be. The atlas is C1, and that's this one. It's going to hold up the skull. We actually have these little cusps here where the occipital condyles would sit. The axis is this. It sort of spins like an axis. So we have this very prominent point that actually fits up in this region of the atlas. If we say right transverse foramen, because it's going to be on the right side of a cervical foramen, these are the transverse foramen. And if we're looking from the top, then this side would be the right side. The inferior articulating process is this inferior portion. So put this over here. And the spinous process is going to be this part. The thoracic vertebrae is listed here with the lumbar next and the sacrum with coccyx. The transverse process of a lumbar vertebrae, these portions. Vertebral foramen of a thoracic vertebrae. The right superior articulating process of a thoracic vertebrae. So we're going to look in this picture, and the superior articulating process we can see from the side view. The transverse process of a thoracic vertebrae, that is these two regions. The costal facet is actually found on the anterior surface of these transverse processes, because that's where the ribs butt up against and brace themselves. Body of a thoracic vertebrae. We don't have any cervical vertebrae on this page. Inferior articulating process of a lumbar vertebrae. So that would be this inferior articulating process, and the lumbar is in this picture. Spinous process of a thoracic vertebrae. We have thoracic here, so the spinous process is this portion that sticks out. We can feel it with our fingers when we run it down somebody's back. Spinous process of a lumbar vertebrae. This. It's a lot stumpier and thicker. The sacrum and coccyx, we have the sacrum here, and then the coccyx sits at the end. For the cervical vertebrae, we have 7 cervical vertebrae. We have 12 thoracic vertebrae, each are attached to a pair of ribs, and we have 5 lumbar vertebrae. You should be able to identify the sacrum. The intervertebral foramen are these holes that are the spinal nerves will come out from. We can see the body of thoracic vertebrae within here. We can see spinous process of a lumbar vertebrae, that would be over on this side, and the coccyx at the very bottom.